This will be another episode on internal family systems or IFS. This is kind of IFS is what you'll hear, and that is a modality that you, Rosie, practice. So,
Yeah, my
yeah,
favorite.
I really, yeah, I know, I know. I wanted us to kind of go past just introduction and kind of a few things that we talked about on our last episode, when it comes to natural disasters. One thing that people struggle with a lot is anxiety and depression. And when I asked you to do it, you said you want to do anxiety or depression, and then I said, how about both?
Yeah.
Is
I
that
mean,
okay?
of course, I think it makes a lot of sense because
Hmm.
there's a lot of overlap and
Hmm.
oftentimes they come together or can be even hard to separate.
Yeah, yeah, yeah.
Yeah.
And if you haven't seen the other episode about what IFS is, I suggest, that you go into that one first so you can get a sense of the different parts and how those work. But I'm curious, Rosie, how would a person or a therapist, clinician that practices IFS would go or, and work with somebody who say, hey, I have anxiety, I have depression, or I don't know if it's anxiety one day, depression another day. Like, how would you go into the work? Like that.
Mm. Yeah, it's a good question. I think
Mhm,
it kind of depends, and I
mhm,
usually will start with
mhm,
just helping clients to kind of check in with their bodies and get curious
mhm,
about what's happening,
mhm,
what's kind of happening internally for them, what's coming
mhm,
up for them. And usually it's kind of it's different than like a top-down model where you're like thinking about it logically and trying to figure it out.
mhm,
It's more like, okay, what comes up for me when I'm thinking about my anxiety or my depression? Like when I really think about that feeling, that sensation, and I listen to like what are the parts that kind of come up for me around this, then it can illuminate a lot. And I think, I don't know, like if you've ever seen Inside Out 2, but I
yes.
think they did a,
Oh, the second one. I haven't.
yeah,
I haven't. I
so
have to go
good.
see
If
it.
you haven't seen
Yeah.
it, I highly recommend
Yeah.
it.
I've seen the first one. So
Yeah, I think
so
it's
instead of
like,
like staying up here, level, logic, brain, it
mhm.
tries to really go to the root of the anxiety or depression or those symptoms by diving deeper into the parts.
Yeah. And oftentimes in my experience, like the way that, so why I brought up Inside Out 2, right, is the way
Mm-hmm.
that they show anxiety, I think is really brilliant and well done.
Mm-hmm.
Because a
Mm-hmm.
lot of the time when people actually slow down and start to listen, like what is coming up for me, even around this anxiety, it's like a part of me is really trying
Mm-hmm.
to anticipate every possible way this could go wrong and
Mm-hmm.
try to prevent
Mm-hmm.
it.
Mm-hmm.
And like you literally can't do that. Right? So it can like build and build and build and be this thing where
Mm-hmm.
you're just kind of like, why do I always feel like I have like a live wire inside of me? Right.
Yeah, yeah. What do you mean when you say you really can't do that? I'm just curious.
Yeah, well, you can't anticipate every,
The anticipation.
you
Mm-hmm.
can't prevent every
Mm-hmm.
possible hard or difficult outcome. Like just life is gonna life sometimes. And
Yeah.
we, you know, I think, we just can't.
Certain things are just out of our control.
Exactly.
Yeah, yeah. And
Yeah.
that's one thing that shows up with anxiety, like you're saying a lot, is how do I contain, how do I keep, people call it controlling. I actually say, well, that need for control is just really your anxiety trying to contain certain situations so that you can self-soothe, but life is gonna life, like you're saying.
Yeah.
Now, when it comes to IFS, have you noticed specific parts that may show up more with anxiety or depression? How do those work?
Yeah, that's a great question. So I think with anxiety, it's often a manager part that's trying to prevent
Mhm,
pain, right? Trying to figure out like how do I manage this situation so that I don't experience a painful outcome, right? And with depression, I, I think it can look different ways, but something that I
mhm,
commonly see is
mhm,
kind of in these positions where people feel like disempowered in their lives, or like they have to kind of take on caregiving
Mhm.
roles or whatever, right? Like there's this part that kind of
Mhm.
forces them to rest. And
Mhm.
that can often be the depression, right? Like I can't live up to all that I have on my shoulders, and like I just need to shut down, right? Or it
Mhm.
can kind of
Mhm.
come from more of like an inner child or exile part that's like really like feeling consumed by the weight of trauma that they may have gone through, for example.
Mhm.
Yeah. I
Yeah.
mean, those are some of the common ways I've seen, but and it can look different kind of in
For
everybody's
different
stuff.
people. Yeah.
Yeah.
Yeah, and depending on the symptoms actually that show up. So how would then, let's say, clients, or how can we help clients and differentiate between those different parts that show up? Is this an anxious part? Is this, like you're saying, a part that is more of a depressive symptom? Like, how do they know the different parts so they can work through, you know, helping themselves, and go to a higher self versus staying in those, or maybe honoring sometimes, right? The
Yeah.
parts that are coming up.
Well, I think it is kind of learning how to
Mm-hmm.
like kind of turn within and
Mm-hmm.
listen to like what is actually coming up for me instead of like trying to
Mm-hmm.
figure it out is
Mm-hmm.
a process, right? I think it
Mm-hmm.
takes time to learn how to really do that, how to slow down and actually listen instead of trying to like figure it out up here, right? And
Mm-hmm.
also to learn to unblend, right? Like they call it unblending when you're
Mm-hmm.
kind of creating that differentiation
Mm-hmm.
from a part so that you can kind of hold space lovingly and compassionately for that part from kind of this place of higher self. And and the more that someone's had trauma or had a life that's kind of taught them that they need to protect themselves, the longer that can take.
So on blending is going to
Mhm.
take longer. And you mentioned the self, the higher self. So what is the role of the higher self in the process? There's a shorter term or longer term, but what is the role in helping someone maybe decrease those symptoms of anxiety or depression? Can you go into that a bit more? And by the
Yeah,
way, you can slow me down. I'm also maybe asking you these questions because I really want to talk about it, but I know our time is shorter today. So you
yeah,
can slow me down.
yeah. No, it's okay. I mean, I don't have anywhere I have to be right
Hmm.
at the hour, but if you do,
Okay.
we can
Hmm.
end. But yeah, so
So the role of the higher self.
it kind of looks different, right? Like
Hmm.
sometimes depression, for example, can
Hmm.
be chemical or hormonal, right? And then
Hmm.
parts might be organizing around like feeling really stressed about this
Hmm.
kind of noticing of like, oh, I
Hmm.
can't feel joy or I can't enjoy playing with my kids or
Hmm.
whatever, right? For example.
Hmm.
And sometimes it is kind of like those symptoms might be coming from a part. So, but in both cases, self is more like being able to separate enough, unblend, right, from these parts
Hmm.
to build relationships with them from this kind of higher, truer self
Hmm.
creates more harmony and can help the parts to unburden from feeling like they have to show up in this way to protect you, or they
Hmm.
have to hold this like intense position of like, if I don't do this, then something really terrible is going to happen, right? So being able to lead from a position of self where parts are more kind of in this role of like feeling unburdened in the weight of what they feel like they have to do, and can actually
Yeah.
they can trust you to lead, right? And also it helps I'm losing my train of thought. It helps the parts to kind of show up in ways that they prefer, right? Like sometimes an anxious part might really love to plan, right? Or really love
Hmm.
to schedule
Hmm.
things, or like use tools, and being able to kind of empower parts to not feel so alone or so
Mm-hmm.
confined to their roles, and to be able to like actually show up how they want to. And
Mm-hmm.
it also creates more kind of harmony between parts. Sometimes it can be really painful when we have parts that are really like at war with one another, or like polarized, right?
Polarized. Mm-hmm.
We've talked about that in the earlier
Yeah.
video, but the
Mm-hmm.
it helps kind of parts to feel more in harmony with one another,
Yeah.
so there's not so
Yes.
much conflict.
So if I were to simplify it, the way I see it is my higher self would be maybe myself when it's centered, or kind of, to use images, I can like look at myself down here, and down there I see the anxious part of me that feels like I have to organize. If I don't organize my week, I may spiral.
Mhm.
But if we are in harmony, I can say, okay, I understand that this helps me stay centered. So by doing this, I'm honoring that part that likes to do that. And coming from a place of compassion, lovingly, I'm gonna just organize my week. That way I reduce the or chance of feeling like highly anxious. So then
Mhm.
I allow that part to be okay. Is that would be a more simpler way to put it, right? But that it
Yeah.
comes from a place of, I don't want to use the word detached, but it's more of like I'm the observer of my own self.
Yeah. Well, it's kind of like I can see when this part's feeling anxious,
Right.
and then I can like
Mm-hmm.
turn towards it with
Mm-hmm.
compassion. And
Mm-hmm.
then by kind of continuing to build relationships with these parts, that
Yeah.
it might
Yeah.
feel a lot less scary or intense, and more
Mm-hmm.
kind of coming from a place of like peacefulness, where like feeling empowered, like, oh, I can do this, this will help. And sometimes
Mm-hmm.
parts even like to have like, these are tools that I can use to help me get back
Mm-hmm.
into a place where I'm self-led, right? Like, oh, I will use box breathing, or I will use this
Let
tool,
me
or
let me ask you this when it
Mhm.
comes to IFS, because you talked about polarized parts. So this would be parts are in harmony, the way we're speaking right now. But let's say that parts are polarized
Mhm.
and you are in a depressive state, you're isolating,
Yeah.
you're low motivation, low energy, you don't want to do anything, don't want to talk to people, irritable, like, don't talk to me.
Mhm.
And you know that getting outside, getting sunlight, going for a 5 minute, 10 minute walk is good, because that's what your higher self is saying, hey, let's do this. We know this is good for you. But the other part of you, it's like, no, can't get out of bed right now. Not
Mhm.
going to do the things that I have to do. Maybe I'm gonna call sick today to work. How would IFS work with that, resistance or polarize different parts where one can see what's good and then the other one's like, but I am feeling so down that I can't really deal with this.
Mhm. I mean, I think you bring up a really interesting distinction, because if there is resistance, that's usually
Mm-hmm.
like a self-like part, right? That's not
Mm-hmm.
actually self. Self is like more of kind of this
Mm-hmm.
energy of like
Mm-hmm.
compassion, and,
Mm-hmm.
like creativity and connectedness, and just
Mm-hmm.
kind of this presence. Whereas, like,
Mm-hmm.
if we have this agenda where it's like,
Mm-hmm.
okay, I have to do this thing, and this is how we get out of this, or
Mm-hmm.
whatever, like, that
Mm-hmm.
can actually be a self-like part, which is also beautiful, right? Like, all parts
Mm-hmm.
have purpose, but
Mm-hmm.
I think being able to slow down and turn towards the sadness or the grief,
Mm-hmm.
or the,
Mm-hmm.
whatever's coming up kind of around that
Mm-hmm.
depression,
Mm-hmm.
from a place of curiosity,
Mm-hmm. Yeah.
allows for that part to feel like some level of choicefulness, right? Like, to kind
Mm-hmm.
of bring it back to Inside Out, like, if you think about
Mm-hmm.
like joy is like dragging sadness along, right? Like, that's kind of more of like the kind of polarization you're describing, right? But when we're
Mm-hmm.
able to just like sit down with the sadness and really like listen, like, okay, what's coming up? Why are you sad? Right?
Mm-hmm.
It gives them like an opportunity to maybe show up differently. And
Yeah.
sometimes those parts are like, there might be a part that's like, we have to do this and we have to do this and it's going to make us feel so good. And then this other part's like, this is way too much. I'm going to just lay here now.
Mm-hmm.
Right? So sometimes that can be the polarization.
Yeah. Just
Yeah.
feeling the overwhelmed by the other part.
Totally.
Yeah, yeah, yeah. That's actually good. Have you seen any of your clients work through something like this, and how do they come through on the other side?
Mm. Yeah, that's a great question. I think that it really kind of depends on
Mm-hmm.
why, right? Like, so
Mm-hmm.
if a client is experiencing more kind of hormonal reasons around why
Mm-hmm.
they're depressed, then it might be kind of more building scaffolding around, like, okay,
Mm-hmm.
this is the time of the month where I'm feeling more anxious or I'm feeling, more
Mm-hmm.
like you think about like hormones or
Yeah.
PMDD, right? Where
Mm-hmm.
we're more impacted by kind of the hormonal flow for women.
Right. So learning how to acknowledge when that time is coming around, or giving
Yeah,
ourselves compassion because we understand that maybe there is a cycle of hormones that is going to impact our mood. That
yeah.
would be a way to work through that.
Yeah, and building like gentle kind of
Mhm.
ways, scaffolding around that part. It's
Mhm.
like, okay, well,
Mhm.
this is when I'm gonna feel like this, and I'm not gonna want to eat, so I'm just gonna have on hand, like these really easy to access foods, for example, right?
Mhm.
Or like when it's kind of an exile part that's just like
Mhm.
flooding the system, and then other parts are like freaking out, trying to get
Mhm.
you out of that energy, like being able to kind of reason with, for lack of a better term, that exile, and help them to understand that, like,
Mm.
if you don't flood the system, I can actually stay with you more effectively
Mhm.
because other parts won't feel such urgency to
Mhm.
get me out of the intensity of that emotion.
Mhm.
Yeah.
Yeah. Okay. Yeah. I was just curious, like how the IFS work through that.
Yeah. Yeah. It's
Yeah.
definitely
It's
interesting.
resourcing. Yeah.
Mhm.
A lot of resourcing.
Yeah. Yeah. And sometimes, you can even use parts as resources, like I was mentioning
Mhm.
before, like
Mhm.
that part that's like, okay, we got to get to a better place, right? Like having tools that they
Having
for,
another part that is your cheerleader.
right, right. And maybe that joy part, to use that example, might
Mhm.
be soothed by, okay, like that part's really sad and I don't know how to fix it, but I can practice these breathing exercises, or I can use, journaling or
Mhm.
hiking or whatever,
Mhm.
whatever I can actually
Mhm.
access in this
Yeah,
state.
yeah. You actually bring up another one of my questions, and that's, I feel like that's the last one I have. But how do people then integrate, because mindfulness is such a great resource, like you speak about IFS and I hear mindfulness, right?
Yeah.
Come back to your body, come back to the present, notice what you're feeling, notice your thoughts, what's going around you, what resources do you have? Is it hormonal? A lot of it is really noticing.
Mhm.
So I'm curious if there is something more specific. I know we've talked about mindfulness in another episode, but if there is anything that you feel like we've left out that should be important, or maybe important to mention, as people learn how to integrate this present moment.
Yeah. Yeah. Well, I mean, I think
Hmm.
when people come to me having already, had a spiritual practice
Hmm.
where they're practicing mindfulness or meditation, for
Hmm.
example, they often are a lot, can access self
Hmm.
or unblend a lot more easily. And
Hmm.
so a lot of those practices are really good, right? Like it's important
Hmm.
to have kind of curiosity of like, what works for me? Do I really love
Hmm.
to, does it
Hmm.
help me to kind of get to a centered place to be creative? Or does it really work for me to kind of get outside and be in nature? Or, like, who are the people that make me remember who I am, or like,
Mm-hmm.
help me to feel more kind of back grounded in myself,
Yeah.
bring out that my best self, for lack of a better term, right?
Mm-hmm.
But I mean, I think also I've mentioned parts mapping,
Mm-hmm.
and that just like a bullet points of like
Mm-hmm.
what's coming up for you, that even just that process can help you to kind of unblend and be able to see like, okay, I'm feeling this and I'm feeling this and this is what's coming up for
Mm-hmm.
me, right? And that can be really orienting. Also, there's a lot of really good guided meditations on IFS out there from Richard
Yeah.
Schwartz or a lot of
Mm-hmm.
other people. I even have one somewhere floating around on the internet. But
Yeah.
um
Yeah. He's very good with his guided meditation.
yeah, he's great. He's great. I think that's often a really good
Mm-hmm.
way
Mm-hmm.
to kind of get back in your body, or
Mm-hmm.
yoga, right?
Mm-hmm.
But it's different for everybody, kind of
Right.
what works for you, what feels like a chore versus what feels like, okay, this is fun. This is like a way that
Mm-hmm.
I use creativity a lot to kind of help myself get
Mm-hmm.
back to a grounded place, because all of my inner children are very creative, like I have some very creative parts, and
Yeah.
yeah.
Yeah. So you're saying explore what works for you
Yeah.
individually to bring yourself back to centered
Mm-hmm.
in a mindful, loving, kind way,
Mm-hmm.
and
Yeah.
have those resources available for when you need them.
Yeah.
It just
Yeah.
makes the process easier.
Yeah, totally. And just kind of being curious about like what are those things, or sometimes I think it can be helpful to think about like what did I enjoy doing as a kid, right? Like that can often be a way to kind of like reconnect back with, especially some of those younger protectors or exiles that
Mm-hmm.
are, maybe they really love to dance or, roller skate or
Mm-hmm.
whatever, like being able to kind of tap into that
Mm-hmm.
play.
Yeah.
Yeah.
Yeah. To bring yourself. Okay. Anything else that you feel like you want to when it comes to IFS and anxiety and depression?
I mean,
Mm-hmm.
I think it's really important that to just note that like sometimes it is, I know I mentioned this already, right? But I think when I first heard this idea that like my mental health symptoms can be parts, there was a part of me that felt very like minimized about that, especially around my
Mm-hmm.
ADHD, because you hear like
Mm-hmm.
you're making it up or whatever
Yeah.
from so many
So it's
places.
hard to convince people about those.
Yeah.
Mm-hmm.
Sometimes it is a way that a part is trying to help you or
Mm-hmm.
protect you from taking on
Mm-hmm.
too much, or from
Mm-hmm.
being hurt or
Mm-hmm.
whatever. And sometimes it's actually like this is something that's happening with me biologically, chemically, and like I have parts that kind of organize around trying to
Mm-hmm.
manage that.
Mm-hmm.
Yeah.
Yeah. Yeah. I think I don't know. Were you gonna say something else, or maybe I just lost it?
No, I mean, I think I just wanted to kind of
Mm-hmm.
reiterate that
Mm-hmm.
it's like both are valid, right? You might
Got
have
it.
parts that are
Yes.
expressing themselves as mental health symptoms, and you might have kind of biochemical reasons for feeling
Okay. Yes. That's what I
certain
thought.
things,
Mm-hmm.
and have parts that are trying to manage that. But
Yeah. So not to invalidate the different parts that may be coming up at the same time, which is actually sometimes is something new or a new concept for people.
mhm.
So it's not black or white. There could be different things happening at once for you.
Yeah, yeah.
Yeah.
And I think sometimes parts can also use what's already
Mm-hmm.
biologically there. Like, for example, with my
Mm-hmm.
ADHD, I have a distracting part that's like, "Ooh, this is a lot emotionally. Look over here." Like,
The shiny stuff.
yeah, right.
But it's
So,
helpful, right? It helps you. It serves a purpose.
yeah,
Yeah.
yeah. And they're all valid. And parts have
Mm-hmm.
wisdom. There's a reason that they're there. They didn't come from
Yeah.
nothing. And
Yeah. I think that one is a really important point to remind people that there is a reason why different parts of ourselves behaving in a specific way. And that's why, when I hear about IFS, that's why we honor the different parts
Mhm.
rather than shame them. And
Yeah.
it's not getting rid of them, it's how do we know which part is showing up and when, and what is the intent, what is the function of that part at that specific moment. Does it need help? It may need some support, and that's that relationship
Yeah.
between parts rather than the polarization. But it's not rejecting, one over the other. It's
Yeah.
learning how to, like you call them, unblend them so that we can come from a higher self and be kind and supportive and loving towards them.
Yeah, and to unburden them, right? Like I think
Mm-hmm.
parts often get stuck in the past and traumas, right? And
Mm-hmm.
have these kind
Mm-hmm.
of rigid beliefs or rigid ways they feel like they have to show up. And so being able to
Yeah.
unburden and kind of
Mm-hmm.
heal the underlying reasons why that part feels like it needs to show up that way, or what that part is taken on based off of past experiences,
Mm-hmm.
helps parts to feel more liberated and
Yeah.
peaceful and
Yeah.
choiceful in how they want to show up. Yeah.
Right. Yeah. Thank you, Rosie.
Yeah, thank you.
Yeah. Okay. It was
Don't
another good episode. Go ahead.
forget. Sorry, we're always talking over each other. I was gonna say too, don't forget to subscribe. Hit the button,
Yes.
the bell below if you want
Yeah.
to find out when we have another episode coming out.
Yeah. And make sure you let us know if there's anything specific that you want, to be covered, and we can see if that is something that we can cover because we are not experts at everything.
No,
Okay.
we're not.
Till next time.
Bye.